PES NASM Integrated Training Essentials. Chapter 1, Learning Objectives. Upon completion of this chapter, you will be able to define integrated training, identify the principles of integrated training, explain the components, scientific rationale, and evidence for the integrated training. Introduction. Sports performance professionals follow a comprehensive, systematic, and integrated training approach. To bridge the ever-widening gap between science and practical application, a full understanding of the structure and function of the human movement system is needed to stay on the cutting edge of research, sports science, and practical application. Function in athletics represents integrated multiplanar movement that involves acceleration, deceleration, and stabilization during sport actions. Integrated training is a comprehensive approach that attempts to improve all components necessary for an athlete to perform at the highest level and prevent injury. Integrated training does this by focusing on developing functional strength and neuromuscular efficiency. Functional strength is the ability of the neuromuscular skeleton to efficiently and effectively produce force, reduce force, and dynamically stabilize the entire human movement system during functional movements. Neuromuscular efficiency is the ability of the central nervous system to allow agonists, antagonists, synergists, stabilizers, and neutralizers, muscles that counteract unwanted actions of the other muscles, to work interdependently during dynamic athletic activities. Traditional strength and conditioning programs often focus on absolute or maximal strength gains in isolated muscle, chiefly the prime movers, throughout a single plane of motion. Functional athletic activities, however, are multiplanar and require acceleration, deceleration, and dynamic stabilization. While some functional movements may appear to be a single plane dominant, dynamic stabilization in other planes is required for optimal neuromuscular efficiency and performance. Sports performance professionals recognize that functional athletic movements require a highly complex and integrated training system. This paradigm shift directs training towards the entire human movement system through all planes of motion by establishing high levels of functional strength and neuromuscular efficiency. To do this, the sports performance professional will design training programs that integrate flexibility, core, balance, plyometric speed, agility, and quickness, resistance, and sport-specific metabolic energy system training. Integrated training principles. Heading: Utilization of the stretch shortening cycle. An important factor in athletic performance is explosive force. Sports that require sprinting, cutting, jumping, and throwing rely heavily on integrating the speed, strength, and power of an athlete. Specific exercises can increase power output and explosiveness by training muscle to do more work in a shorter amount of time. This occurs by utilizing the stretch shortening cycle, which occurs when an activated muscle transitions from an eccentric contraction deceleration to a rapid concentric contraction acceleration. This occurs by utilizing the stretch shortening cycle, which occurs when an activated muscle transitions from an eccentric contraction to a rapid concentric contraction. The rapid eccentric contraction creates a stretch reflex, storing potential energy used to produce a concentric contraction more forceful than could otherwise be generated by the resting muscle. The shorter the amount of time between the eccentric and the concentric contraction, the greater the potential energy stored and used for a more concentric force production. Stabilization strength, core strength, and neuromuscular efficiency may help to control the time between the eccentric and concentric. When eccentric strength, neuromuscular efficiency, and stabilization strength are optimized, athletes will realize greater concentric force production. Thus, exercises that accentuate the stretch shortening cycle are valuable in the overall development of an athlete. Utilization of integrated training continue, page 3. Most strength and conditioning programs focus on isolated uniplanar exercise to maximize absolute strength gains and hypertrophy. However, the human movement system evolved using all three planes of motion as an interdependent unit, and the central nervous system naturally optimizes the selection of the muscle synergies to perform integrated movement patterns. Thus, isolated training does little to improve overall athletic performance, even everyday performance. In contrast, training that exploits integrated functional movement patterns targets synergistic muscles to regulate isometric, concentric, and eccentric force while dynamically stabilizing the entire human movement system in all three planes of motion. This creates maximal motor unit recruitment and facilitates a greater overall training response. The athlete who applies an integrated functional approach to training will develop high levels of dynamic flexibility, core strength, neuromuscular control, power, speed, agility, quickness, and functional strength. In addition, an athlete may develop similar or even greater levels of hypertrophy following improved motor unit recruitment. Training in all planes of motion. Athletic actions occur in all three planes of motion: sagittal, frontal, or coronal, and transverse. Often traditional strength and conditioning exercises occur in the sagittal plane, with a primary emphasis on concentric production. An athletic activity may appear to be dominant in one plane, e.g. sprinting, but movements in other two planes of motion must be controlled for effective performance. If a muscle is dominant in a primarily one plane, e.g. gluteus medius in the frontal plane, quadriceps femoris in the sagittal plane, and the internal oblique in the transverse plane, a multiplanar training program will enhance overall symmetry in athletic development. This will enable the athlete to efficiently and effectively prepare for athletic activities and injury prevention because many athletes' injuries occur in the frontal and transverse plane. Training only in a sagittal plane will not effectively prepare the athlete's muscle dominant in the frontal and transverse plane. Training only in the sagittal plane will not effectively prepare the athlete's muscles dominant in the frontal and transverse plane. Training with optimum posture. Posture is a dynamic controlling quality. Optimum alignment of each segment of the human movement system is a cornerstone to any functional sports performance program. If one component of the human movement system is out of alignment, other components will have to compensate, decreasing neuromuscular efficiency and increasing the chance of injury. Poor posture during training can lead to muscle imbalances, joint dysfunctions, and impairment of human movement system. Pro tip: complex multiplanar proprioceptively enriched exercises are more challenging than single plane supported exercises. Complex exercises require a higher degree of attention and more motor coordination. Length-tension relationship. The resting length of a muscle and the tension the muscle can produce at this resting length. Force couple relationship. Muscle groups moving together to produce movement around the joint. This is page 4. Altered reciprocal inhibition. Training with proper posture ensures optimal results and decrease the risk of developing muscle imbalances, joint dysfunction, and tissue overload. Allowing an athlete to perform exercises with poor lumbar posture may result in the development of muscle imbalances and possible injury. A functional integrated training program of the entire human movement system ensures maintenance of structural integrated while requiring your athlete to perform. A functional integrated training program of the entire human movement system ensures maintenance of structural integrity while requiring your athlete to perform exercises correctly with proper postural control. Training for optimal muscle balance. Training for optimal muscle balance. Muscles function optimally from an ideal predetermined length, thus an optimum length-tension relationship. The length-tension relationship is altered when muscle is stimulated at a length less than or greater than this optimal length, altering force-coupled relationship and joint kinematics. Subtle changes in posture, pattern overload, injury, and decreased neuromuscular efficiency can alter the resting length of muscle, which can lead to muscle imbalances. Muscle overactivity, adaptive muscle shortening, or both can cause altered reciprocal inhibition and synergistic dominance. Altered reciprocal inhibition results in a decreased force production. Altered reciprocal inhibition results in decreased force production by the prime movers and lead to compensation by the synergists. This is synergistic dominance. Synergistic dominance leads to altered movement patterns and decreased neuromuscular control. Therefore, all sports performance programs should be planned and executed to ensure the development of optimal muscle balance, which in turn will ensure maintenance of the structural integrity of the entire human movement system. New heading, training for optimal muscle function. Training for optimal muscle function. Training for optimal muscle function. Muscles function eccentrically, isometrically, and concentrically in all three planes of motion. Movement is a complex event orchestrated by the central nervous system. The CNS executes pre-programmed patterns of movement that can be modified in response to gravity, ground forces, and momentum that must be trained accordingly. For example, the CNS allows the gluteus maximus muscle to work eccentrically to decelerate hip flexion, internal rotation, adduction, and tibial internal rotation through its attachment to the IT band, iliotibial band, isometrically to stabilize the SI joint, and concentrically to extend and externally rotate the hip. The typical way to strengthen the gluteus maximus is to have the athlete perform sagittal plane hip flexion, extension exercises, squats, lunges, step-ups, etc., with little attention to the transverse plane, eccentric function, or stabilization function of the gluteus maximus. It is important to remember that while muscles can have some anatomical individuality, they lack functional individuality. They lack functional individuality. An integrated sports performance training program will focus on multiplanar training, sagittal, frontal, transverse, while activating the entire spectrum of muscle contraction, eccentric, isometric, and concentric, using multiple modalities: free weights, dumbbells, cables, machines, tubing, medicine balls, etc. Incorporating flexibility, core, balance, plyometric, speed, agility, quickness, integrated resistance, training, and sports-specific conditioning to efficiently and effectively prepare athletes for optimal performance and injury prevention. Components of an integrated sports performance program. Page 6. Components of an integrated sports performance program. Flexibility training. Flexibility training. Muscle imbalances and poor flexibility may decrease performance and increase the risk of injury. Because static, active, and dynamic stretching all can be effective for improving range of motion, this complete continuum of flexibility training should be incorporated into a comprehensive training program in order to develop optimum functional range of motion and neuromuscular efficiency. Metabolic energy system training. Metabolic energy system training. Subheading. Of the various components that comprise the total physical fitness program of an athlete, metabolic energy system training, while probably the most studied, is probably the most misunderstood and underrated. Energy system efficiency serves as a foundation for the development of overall fitness and athletic performance. Increases in what in efficiency, regardless of primary energy system reliance, can improve training readiness and athletic performance. While sports performance professionals must be creative in designing metabolic energy system conditioning programs, athletes need to know how to start a safe program that will improve endurance, avoid overtraining, and minimize the risk of injury. Components of integrated sports performance program. Flexibility training, metabolic, core, balance, fly-up, speed, agility, and quickness. Resistance training, sport-specific conditioning. Core training. Core training is the foundation from which a progressive sports performance training program is built. Many athletes develop the strength, power, and endurance, their prime movers, but neglect. Many athletes develop the strength, power, and endurance in their prime movers, but neglect to develop adequate neuromuscular control, strength, power, and endurance in their core. Core training is a systematic and progressive approach to develop muscle balance, neuromuscular efficiency, strength, power, endurance in the core musculature. Page 7. The core has to function optimally to fully harness the strength and power of the prime movers. A stable, strong, and reactively efficient core should be a cornerstone in all integrated sports performance and injury prevention programs. Balance training is the systematic and progressive training process designed to develop neuromuscular efficiency. Balance training is a proprioceptively enriched environment, half foam roll, foam pad, balance, disc. Stimulates neuromuscular adaptations leading to improved intramuscular and intermuscular coordination. That is, recruiting the right muscles to work at the right time with the right amount of force for the desired outcome. Intramuscular coordination is the ability of the central nervous system to improve motor unit recruitment, rate coding, and synchronization within an individual muscle. Intermuscular coordination is the ability of the entire human movement system and each muscular subsystem to work interdependently to improve movement efficiency. Another CNS function, improved intra and intermuscular efficiency, will yield greater recruitment of the agonist musculature and less interference from the antagonist muscle. This will result in greater force production and injury prevention. Plyometric training. Enhanced athletic performance is related to the rate of force production, regulated by the central nervous system. The demands of training should occur at speeds that will be encountered during functional activities. So the system learns how to rapidly force production. So the system learns just how rapidly force production will be required. This means the human movement system will only move within a defined range of speed set by the central nervous system. Most human movement involves the stretch-shortening cycle, where deceleration, stretch, transitions to acceleration, shortening. The human movement system must react quickly following an eccentric contraction to produce a concentric contraction and impart the necessary force and acceleration in the proper direction. Plyometric training overloads the stretch-shortening cycle, box jumps, squat jumps, hops, to enhance neuromuscular efficiency, rate of force production, and reduce neuromuscular inhibition by stimulating the proprioceptive mechanisms and elastic properties of the human movement system. Speed, agility, and quickness. As mentioned earlier, human movement occurs in all planes of motion at varying speeds and demands in response to multiple stimuli. The ability to change speed, direction of movement, and appropriately react to all given stimuli is often the difference between injury and safety, in success or failure. Improving speed, change of direction, and reaction time is possible through proper training strategies. These strategies have come to be known as speed, agility, and quickness, or SAQ training. Each of these abilities is an independent quality, yet is related and dependent on the other to optimize human function. Page 8. Integrated multiplanar resistance training. As athletes continue to demonstrate increased levels of performance, efforts to support such performance in a safe manner are important. Muscular fitness is important for the athletic performance and injury prevention. Muscular fitness is expressed in various forms, including maximal strength, relative strength, strength endurance, speed strength, stabilization strength, and functional strength. Resistance training promotes improvements in these areas among athletes and can be used to support optimal development and performance. An integrated resistance training program makes use of the principles of the integrated training discussed previously in this chapter to develop a comprehensive sports performance program that will ensure each individual athlete will achieve their optimal performance and reduce the risk of injury. Sport-specific training. Much attention has been made in sports performance enhancement regarding sport-specific training strategies or training programs that are tailored to a specific sport. The principle of specificity will be discussed in later chapters and is certainly applicable in athletic development. However, it is important to recognize that training does not have to mimic actual sport skills in order to transfer improving them. The most important consideration in athletic development is the degree to which training transfers to improvements on the court or in the field of play. Many factors influence transference, including force of contraction, speed of movement, motor pattern utilized, and load. Many factors influence transference, including force of contraction, speed of movement, motor patterns utilized, and load. It is important to keep in mind that certain aspects of an athlete development program involve general physical development, while others incorporate sport-specific movements in exercise designed to improve performance on specific skills. Integrated sports performance training. The primary goals of sports performance training program are to prevent injury and increase the athletic performance. Measures that may include body composition, flexibility, core, balance, power, speed, agility, quickness, strength, and sport-specific cardiovascular efficiency. Various methods can be used to stimulate these improvements. Many of these methods will be discussed in later chapters. By integrating each component of training into a training plan, we offer our athletes the best route to improve performance. When designing an integrated sports performance program, the sports performance professional should perform a comprehensive sports performance assessment. Assessment data and evaluations of the demands of a given sport should be used in the creation of an integrated performance plan. All sports performance programs should, above all, be safe. Choosing the components of a program requires careful selection of exercise that meet specific criteria. These exercises should be progressive, proprioceptively challenged, stress multiple planes of motion, integrate multiple joints when possible, challenge the entire contraction velocity spectrum, slow to fast, explosive. Exercise progression continuum, slow to fast, known to unknown, stable, controlled, dynamic, functional loop. Low force to high force, correct execution to increased intensity. The sports performance professional should follow a progressive, systematic, functional continuum to allow optimal performance adaptations. The following are key concepts for proper exercise progression: slow to fast, simple to complex, known to unknown, low force to high force, eyes open, eyes closed, static to dynamic, and correct execution of increased repetitions, sets, intensities. With such an approach, athletes can develop optimal levels of functional strength and dynamic stabilization. Neural adaptations become a significant focus of the program instead of striving solely for absolute strength gains. Increasing the proprioceptive demands in a multisensory environment, stability ball, foam pad, balance disc, wobble board, is an important concept in an athlete development. Athletic development and should receive as much attention as increases in external load. As is important concept in athlete development and should receive as much attention as increases in external load. The concept of quality before quantity of training should be emphasized. The sports performance professional must be concerned with sensory information, stimulating the athlete's CNS. If athletes train with poor technique and poor neuromuscular control, they will develop poor motor patterns and poor stabilization. Therefore, an athlete program should focus on the functional continuum. To determine if the program is functional, answer the following questions. Is it progressive? Is it systematic? Is it sport specific? Is it integrated? Is it proprioceptively challenging? Is it based on functional anatomy and evidence-based practices? As mentioned before, integrated sports training is a concept that applies all forms of training in an integrated fashion, such as flexibility training, cardiorespiratory training, balance training, core training, plyometrics training, speed, agility, and quickness training in integrated resistance training in a progressive system. This system developed by NASM is termed OPT model, Optimal Performance Training Model. Exercise selection variables. That's page 11. Functional continuum. Performed in all three planes of motion, uses multi-dimensional movement, uses the entire muscle contraction spectrum. Page 12, OPT model is a OPT model. picture of it. The OPT model is a process of programming that systematically progresses an athlete to any performance goal. As depicted in Figure 1.3, the OPT model is built upon a foundation of stabilization training principles. With the acquisition of proper levels of stabilization, an athlete can then progress into the strength level of the training level. As the athlete obtains ample amounts of strength, the progress into the power level of As an athlete obtains ample amounts of strength, they progress into the power level of the training model. Scientific rationale for the OPT model. As mentioned previously, the OPT model is divided into 3 different levels. These include stabilization, strength, and power. Each level is built upon and dependent on the prior level. Within each level, there exist specific phases of training that progress an athlete through the level. Phase 1, stabilization, endurance. Phase 2, strength, endurance training. Phase 3, hypertrophy training. Phase 4, maximal strength training. Phase 5, power training. 6, maximal power training. It is imperative that the sports performance professional understand the scientific rationale behind each phase in order to properly use the OPT model. This model will be referred to throughout the text to show how components of an integrated sports training program are incorporated into the training system. Stabilization level of training. The stabilization level consists of 1 phase of training, stabilization endurance training. The main focus of the stabilization endurance training is to increase stabilization strength and develop optimal communication between one's nervous system and muscular system. The progression for this phase is page 13. The progression for this phase of training is proprioceptively based. This means difficulty is increased by introducing more challenge to the balance and stabilization systems of the body versus simply increasing the load. Stabilization training must be done prior to advancing to the strength and power levels. As research has shown that inefficient stabilization can lead to altered force production in muscles, increased stress at the joints, tissue overload, and eventually injury. This level essentially prepares the athlete structure to engage in more demanding exercise by correcting muscle imbalances, increasing flexibility and extensibility of the muscles, as well as increasing the joint and postural stabilization mechanisms. The strength level of training. Strength level of training follows the successful completion of stabilization level. The emphasis in this level is to enhance stabilization strength while increasing prime mover strength. This is also the level of training an athlete will progress to if their goals are muscle growth, hypertrophy, or maximal strength, lifting heavy loads. This level of training consists of 3 phases of training: strength endurance training, hypertrophy training, and maximal strength training. The goal of strength endurance training is to enhance stabilization, strength, and endurance while increasing prime mover strength. These 2 adaptations are accomplished by performing 2 exercises in a superset manner with a similar joint dynamics. One exercise is more traditional and performed in a more stable environment, bench press, while the other is an integrated exercise performed in a less stable environment, suspension trainer push-up. The principle behind this method is to work the prime movers predominantly with the first exercise to elicit prime mover strength. By immediately following with an exercise that challenges the stabilizer, neuromuscular and postural strength, endurance, and dynamic joint stabilization are enhanced. By immediately following with an exercise that challenges the stabilizers, neuromuscular and postural stabilization, endurance, and dynamic joint stabilization aren't here. Other phases of strength levels are hypertrophy training for the goal of maximal muscle growth and maximal strength training for the goal of increasing maximal prime mover strength. Power level of the OPT model emphasizes the development of speed and power. The speed and power with which athletes can produce neuromuscular action. The speed and power with which athletes can produce muscular actions determine successful performance in most sports. This level of training is necessary to enhance the speed spectrum the body is allowed to operate within. The speed with which muscles are able to exert force is dictated by neuromuscular system. Therefore, the body will only be able to move within a set range of speed determined by the nervous system. This is achieved through two phases of training termed power training and maximal power. The premise behind power training is the execution of more traditional strength exercises, barbell in a superset with plyometric power exercise, barbell squat in a superset with a plyometric power exercise of similar joint jump squats. So it's a squat, regular squat, and jump squat. This is to enhance prime mover strength while also improving the rate of force production. This is to enhance prime mover strength and while also improving the rate of force production. Use of maximal power training is the next progression to produce maximal acceleration and rate of force production. This phase of training is typically reserved for high-level athletes who require maximal levels of power. Summary. While improvements in strength, power, and speed are often the highlights of athlete development, the program for today's athlete must also address factors such as appropriate forms of flexibility, increasing stabilization, strength, and endurance, and training in multi-planar environment. All of these forms of training have been specifically designed to follow physiological principles of the human movement system to provide a systematic progression to train, minimizing injury and maximize athletes.